Roll call, please.
Here.
Harvey,
Here.
Rolla,
Here.
Hankins,
Here.
McKinnis,
Here.
Kuntz,
Here.
Colorado,
Here.
Howard.
Here. All present. Review and approval of the meeting minutes from November 2nd, 2021. Can I have a
Move.
motion? I'm sorry, who is that?
Me.
Charlie? Is there a second?
I'll second that.
Can we have discussion, Madam Chair, before we vote?
Always.
Thank you. I would note on our agenda for today, last meeting, we did not elect a vice chair. You appointed one and it was to be moved to unfinished business. I don't see that on today's agenda. Number two, under the health officer contract, I would appreciate if the minutes properly reflected my vote, which would include the terminology based on the advice of our attorney. I regretfully vote no. If we can add that to the minutes, I would appreciate it.
Is there any objection to adding the language?
I made the motion. I have no objection.
Hearing none, we will add that to the minutes. Mr. Rubin?
Under minutes amended agenda, says motion revision of agenda item and removal of the board chair. Doesn't state who made the motion or seconded it. Normally that's, if there's a motion
right.
made, it usually it says.
I made the revision, but I don't recall who first and seconded that as revised.
I
So-
didn't write it down either, so I don't remember.
I have it written at home, so I will look that up and if there's no objections, we'll add that.
No problems from me.
Just I guess inform us after the fact, please. Just
Mhm.
thank
Jen,
you.
you've got that?
Yeah.
Thank you. Just writing my note about Mr. Hankins' request.
Under removal of board chair, it says, after the first sentence, it says roll call, roll call. It probably just needs to be in there once.
Oh, yeah, sorry, my bad.
Any others? The motion to approve the meeting minutes as corrected by Charlie, second by Pellerito as corrected. Is that acceptable?
Yep.
Yes.
Is there any further discussion? Hearing none, roll call, please.
Colorado,
Yes.
Howard,
Yes.
Rubin,
Yes.
Harvey,
Yes?
Rolla,
Yes.
Hankins,
Yes.
McKinnis,
Yes.
Kuntz.
Yes.
Motion passes. Review and approval of the agenda. I'd like to add a couple items. Under public comment, a board member update so that each county can let us know where you're at regarding your Board of Commissioners. Also, under unfinished business / various matters, we can talk about a couple of things. We need to talk about our next meeting, our time and place. We can talk about the vice chair. Those were kind of a few things that I had. Just housekeeping, if you will. If that's acceptable.
And where was that again?
We have an item called unfinished business. We'll put that as unfinished business / various matters.
Great.
Is that acceptable for everybody?
Oh, I see. Oh, okay. Yeah. Okay.
Would that be the appropriate place to talk about meeting times? Yeah.
So I'll entertain a motion with those changes.
So moved, Julie. I'll second.
It's been moved in second. Is there any discussion? Hearing none, roll call, please.
Roloff,
Yes.
Jenkins,
Yes.
McGinnis,
Yes.
Coon,
Yes.
Valerito,
Yes.
Powers,
Yes.
Ruby,
Yes.
Bargy.
Yes. Just so everyone's aware, I am working on getting our parliamentarian hooked in. So just like we did last time. If you want to use this one, this will help me out with that. And move on to public comment. Again, please be reminded that we are using the rules as adopted at our last meeting for public comment. We're still working through bylaws and subcommittee for the other items as discussed at our last meeting. If there's any contention, we will deal with it at that point. I have two signed up for public comment. Pat Freilich.
Morning, my name is Pat Freilich and I'm a retired registered nurse who worked as a public health nurse and nursing supervisor for over 20 years and held the position of the Director of Family Health for over 20 years. And I'm here to address the essential services needed for a health department to provide quality services in your communities. The public face of the health department are represented by the services provided in dental clinics, nurses and technicians working in the clinics, mental health therapists in the schools, and environmental health staff ensuring safety in the food service industry and the environment. For these services to occur, there are a multitude of individuals necessary to support them. Finance, keeping all program budgets separate and tracking and reporting all expenses to the funders, billing multiple insurance companies, medical, dental, Medicaid, Medicare, Priority Health, Blue Cross, IT, ensuring computer hardware, software, laptops, printers, phone systems are all operational, and providing technical support for multiple electronic records, medical records, dental records, environmental health, and providing cybersecurity and HIPAA and making sure that those standards are upheld and data is backed up. Purchasing, ensuring supplies are delivered to dental clinics, WIC, school clinics, immunization clinics so that they're operational. Medical director, providing orders for breast and cervical cancer screening, immunization clinics, and many other functions. And administrators, securing grants, writing protocols to ensure that all federal and state standards are met, partnering with local and state entities to address community needs such as environmental toxins, substance exposed infants, and mental health needs of students. The health department has a crucial organizational structure to provide services, is cost effective, shares nurses, technicians, mental health therapists, environmental health staff, and other personnel among the counties when needed, and ensures the highest level of care for people in your communities. Thank you.
Thank you. Linda Yarrow.
Good morning. My name is Linda Yarrow, and I am a retired health officer and public health nurse with over 40 years of experience with the Health Department of Northwest Michigan. I'd like to speak to the formation of the Health Department and its commendation for excellence and innovation in public health practice through accreditation. The Health Department of Northwest Michigan was formed in 1930, over 90 years ago, as a 4-county district health department. More formally, the Public Health Code describes its structure, purpose, and authority. Pat Freilich and I have recognized that we've been here for almost half of those 90 years. So we have a lot of history here. The Health Department is a complex organization that has developed many services over the years and include environmental health, personal and community health, and oral health. It has continuously earned full accreditation with commendation in excellence and innovation in public health practice from the Michigan Department of Health and Human Services. The Board of Health, the leadership and staff always receive special recognition for their commitment to the population they serve. Noted examples of excellence and innovation have included integrated services and a call center for information and scheduling to make it easier for families to access services. Dental Clinics North, a partnership in public health, launched in 1991 in an effort to address the lack of oral health care for children, and has grown to a system of care serving over 25,000 low-income children and adults each year through 8 dental clinics across northern Michigan. Development and expansion of a laboratory in Gaylord, a regional laboratory. Northern Michigan Community Health Innovation Region, a partnership of health and community partners serving the health needs of the population through better coordination and continuous identification of needs. The support of the Board of Health is critical to the health department's ability to continue its tradition and excellence in innovation. While you have had differences, I remain hopeful that you can work together and work out those differences with common understandings
Thank you.
and commitment to the continuation of the health department in Northwest Michigan. Thank you.
Thank you. Abby Mandeville?
Not sure if we're going by 2 minutes or 2 minutes and 25 seconds, but I'll take the 2 minutes, 25 seconds. Abby Mandeville, Milltown County. I'm taking one for the team today. Nobody wants to come and do this. It's old hat. All heard the same old thing time and time and time again. But what I am here to talk about is a couple of things. There's a rumor going around, word on the streets, that there are police escort or a police presence that comes to these meetings because Lisa has requested that. Rumor. I don't know if it's true or not. But Lisa, if you feel threatened, you shouldn't. You think too much of yourself. People don't care. What they care about is their kids. They're tired of you messing with their kids. And how about the people that are afraid of the police? Have you thought about them? It's okay for you to feel afraid, but not for them to feel afraid. I think we have a problem with that. Maybe your own security detail would be better. The other thing I was thinking about is if one mask is good, 2 masks is better. 3 masks, better yet. Dr. Fauci, follow the science. I think I am proposing that we put 2 to 3 masks on our children at school. That will solve the problem. My other concern is, and since we have doctors and nurses here that are much more educated than most of us, I'm wondering if you can explain to me, maybe it's a science experiment. So Karen Bargy comes to our meetings, commissioner meetings, no mask. But here, these meetings, she wears a mask. Are you conducting a science experiment with this? If so, how does it work? And maybe we should be conducting that same experiment with our children at schools. Thank you.
Thank you. Any other public comment? Hearing none, public comment is now closed. We'll go to board member update. I guess we'll start with Jairus if you want to, or I can. I can give an update from what Pete's report had.
Yeah, I guess I'm not quite sure exactly what you're asking for.
Okay, so Antrim County asked their administrator to look into what it would take to leave the district health department. And I think there's other counties that have as well. So at our Antrim County meeting 11/18/21, our administrator reported back that only the district can allow a county to leave the district. So this board would have to vote upon a request by a county to leave the district. You must provide 8 core services. There's a 6.25% of funding off the top that goes to the state. That it's I believe it's a penalty of sorts, if I understand correctly. I believe so. And that goes to DHHS. If you can't or won't provide services, then DHHS would seek a court order enforcement. Transition of services provided must be seamless. In the case of Antrim, the county would need to buy out the lease agreement for the Mansalona Clinic from the health department. And again, specific to Antrim County, Sanilac County was the closest in population of a single county health department. And that was just for a reference point. I did additional research. Antrim population is about 23,000, and the 2018 household median income was 52,589. Sanilac was 41,000, and their household median was 45,277. And their fiscal year end of 9/30/18 for health department expenditures was just over 2.5 million. And they do not provide the same services. They provide the 8 core, and they've got some other partnerships with like WIC and some other programming. So just letting you guys know, Antrim County hasn't made any, the board hasn't given any direction. They just requested information, and that was the information that came back. I understand Otsego has made some motions concerning the health department. Julie, do you wish to talk about that, or Rob? Oh, no.
Okay, mute. Is that gonna work? I'm gonna mute mine.
Thank you. Sorry.
We've looked into it. We've made no motions to do anything yet. It's a long process from what we have read or I have read, and entails lengthy discussion and action. Rob?
And I think that's what led to the intergovernmental agreement and the lack of a signed. And I think that's what Mr. Young is probably here to talk about. The counties can't come up with a signed agreement between the counties to run the health department. Charlevoix and Emmett have signed it, but Antrim and Otsego, there's no record of those 2 counties signing. As far as that goes, so that's as far as Otsego is gone with any discussion.
Okay, there's a couple motions that I believe were made at your county
Oh,
regarding.
there was a resolution made requesting Public Act 87, the budget, requesting the state budget director, Office of Management budget, both appropriations for the Senate and the House to investigate the Health Department Northwest and its mask mandate, which specifically stated in Public Act 87 that it's not allowed, and resolution passed by the Board of Health. So that was passed at the board level, and there was a motion that was amended to basically reflect the same that was originally whole money in escrow. So that wanted to read that sometime the judge decides that it's not a law or unconstitutional or unenforceable or not a bureaucrat.
So you requested that the state withhold funds, but the county will pay their.
The county has, the county's is funding.
Okay.
I don't know at what level yet, because that's still in the works.
Okay. And then as far as Public Act 87, the budget basically is what we're talking about.
Yes.
There was language included, and the governor also indicated that it was not enforceable. I believe she used the word unconstitutional. I don't have it in front of me. So there is some discrepancy there. It it's common language that's been used in a letter for vetoing the bill, and has been upheld in the past situations. Again, this is a contentious issue yet to be determined on how that they will be distributing funds in that budget as budgeted. Charlevoix County?
Scott, you have anything?
I know some discussions regarding the health department. There have been no formal.
Same thing. We haven't done any.
Emmett County? About was the ish or on 1930 and by the Public Act. It allows operators as a district. We are a entity agreement that would formalize in absence of being able to find whatever agreement was initially in place. Charlevoix County signed it. 20 years later, Emmett County signed it. However, those were the only two counties, and it is not effective unless all counties, not Seago and Antrim, did it. But because it surfaced and because there was an unsigned copy, we did see some, and Jim Young can talk to us particularly about that agreement. But the concern was that there's a, and I want to be, Mr. Young will correct me if I misspeak, but that the counties we are a if your county has an action that they'd like to request, it comes through your, we don't oversee their decisions either. But DHHS by the way that the Public Act is our oversight. If any Jim to kind of talk about the formal mechanism makes us a district and allows us to.
All right, thank you very much. One thing, please note that this agreement, although it looks like one of the dates is 1972, it can't be. I'm the one that drafted it, and I wasn't up here in 72. But be that as it may, 1992 sounds about right. Jerry Chase, the former health officer, and I, of course, were concerned about the lack of a written agreement among the counties. We are, of course, a legal entity under the Public Health Code, and we can't, by any sort of agreement, try and supersede or overturn what's in the Public Health Code. But the Public Health Code, I respectfully suggest, is deficient in terms of its dealing with the structure or framework of district health departments and the interrelationship of the counties. And so Jerry Chase and I thought that should be addressed. I drafted this based on because another statute called the Urban Cooperation Act allows agreements like this as long as the counties to work together. Obviously, the Public Health Code does. So my friends, is why this, by all of the counties, and Peter in Antrim County, in his talking with county commissioners, because things did approve it, we still had two that just simply never acted on it. It was never declined. It just sort of withered in the process. And like I say, the only discussion I had regarding the agreement that at all raised any concerns with the fact that things are going well. Jim, why do we really need the extra paperwork? And of course, just some of the attorneys weren't really familiar with the Urban Cooperation Act and the advantages that it brought. So I do and still believe the Public Health Code really does not adequately address the interrelationship among counties. Obviously, it's focused on public health. And while we cannot, in any written agreement, try and supersede what's in the Public Health Code, obviously an agreement between counties can't overturn what's in a statute. Nevertheless, in terms of the relationship of the counties, that's what this document was intended to deal with. So that's the background. I'm sorry it's not in effect, but like I say, at the time, things are going well, and other issues arose in all of the counties, and this just sort of withered in the process. So that, my friends, is the background. And so the health department is a legal entity under the Public Health Code, but again, by just relying on that, we're stuck with any lack of clarity in the Public Health Code on certain issues. And those issues really relate to the relationship between units of government that have created a district health department. Any questions?
Several, Jim. Good morning. Like your hat.
Morning. Thank you.
Somebody had to say it, so there you go.
It covers my bald head.
I have the same issue. So because the health department counties have been participating for this many years, is there an implied agreement without an actual signed agreement? And if not, what would prohibit Antrim or Otsego counties who didn't sign from immediately withdrawing from the health department?
I agree with you. I think that it is fair to state that given the historical relationship with the counties, that there is an implied agreement. But that agreement is really covered by the Public Health Code. In terms of withdrawal, obviously, since this agreement is not in effect, the dispute resolution provision, for example, is I mean, there's just no agreement. So it's my proposed wording is meaningless. There is nothing that stops the counties from withdrawing, except to the extent that they have to consider what administrative rules the state has enacted that could impact it. And of course, you've got to look at the long-term legal and financial as well as public service consequences of such a withdrawal. But in terms of giving notice, for example, and following a dispute resolution procedure, that's not required. Okay?
Did you have any other follow-up to that?
I don't.
Okay.
Thank you.
Ms. Vogler?
I just wanted to add that I believe to the extent that there is an implied agreement and that the function of the district health department operates under, and this is one provision I don't have memorized, the Part 24 section that allows the formation of a district health department, that all of the counties would have to agree to allow one county to leave the district health department. So there would have to be a vote of all of the BOCs. Let's just say, for sake of discussion, Antrim wanted to separate. There would have to be, to my understanding, a vote of the BOC of Charlevoix, of Emmett, and of Otsego to allow Antrim to leave, and vice versa.
So if I can ask a clarification question there, are you saying it has to be a unanimous vote by those 4 counties or a simple majority?
My thought is a simple majority, but I have not researched that issue. And I think that would be something that we could follow up with MDHHS. My understanding is that the Antrim County Administrator met with Laura, correct? From MDHHS, who is the individual, I can't pronounce her name. Lisa knows how to pronounce her name. Oh, say it.
De La Rumbellier.
Yeah, that's why I can't pronounce that.
Common spelling.
Yeah, right. Anyway, that she is the contact person at MDHHS for local and district health departments. And she is more than happy to provide Charlevoix, Emmett, and Otsego's administrators with the same discussion and information that Antrim was provided, so that all 4 of the counties have a better understanding of what it would take in order to separate this district health department.
Now, it's my understanding it's not the Board of Commissioners, but rather this board that,
It's the Board of Commissioners.
okay.
Because the Board of Commissioners are the one who place the individual members on this Board of Health. So each county has to agree, because the funding for this health department comes in part from each of your county's budgets. Therefore, I mean, it's common sense, if one county is going to leave and take their money, so to say, with them, that all of the rest of the counties have to agree to that.
So the information that our county administrator gave our board was that the district, only the district being this board, could allow for that to leave. So, and that was from our DHS representative. So maybe just some clarification
Yeah,
on
we
that.
do need some clarification
So
on that,
that
because I
we
have a
can-
different understanding.
So we can get some more information.
Jim, do you
Lisa?
have anything to add to that?
No, I've been told that Lisa, the same thing that you just said, and I believe it's based on an Attorney General's opinion. Remember, Scott mentioned about the implied contract, and I'll bet you that opinion, if it exists, uses that concept. So no, but it is something that I really think we should get a definitive answer regarding. Okay.
Will do.
So going forward, if Antrim and Otsego, and this is just hypothetical, but if they refuse to sign an intergovernmental agreement, are we a legal entity?
Yes.
Yes.
We are, Scott, because remember, there's the public health code, okay? And this really was intended to sort of supplement, if you will, the public health code. And the fact that it's not signed, the fact that there's no agreement, does not alter our status under the public health code, period.
But under my understanding of what you stated earlier, Jim, if Otsego County decided, okay, we're going to form our own health department effective January 1, what would prohibit Otsego County from doing so?
Well, like I say, we have to get a definitive answer regarding whether there's an AG opinion out there and what the procedure is. And so that's why I think you raised a good question. And I think that Lisa Vogler and I should follow up on that, and you get something definitive from us to the extent that we can give you a definitive answer, okay? So it's a very good question, and we should follow up on that.
Thank you, Joe.
Either way, there has to be a vote either of this or of individual boards. So that's the question posed to them. Jairus?
Yeah, Jim, just a question. Just wondering, has there ever been a health department that's gone bankrupt? And if so, what happens then? I mean, if you can't pay your bills, and if the health department of Northwest went bankrupt and Antrim County has to supply critical services, what happens then? Have you seen anything like that?
No, I've not seen anything like that. But my friend, it was that concern. That was one of the reasons I wanted to create a legal entity under the Urban Cooperation Act. What I didn't want, and Jerry and I were concerned about, if, for example, there was a major class action, some type of malpractice lawsuit, if you will, against the health department. What we didn't want is if there was a big judgment against the health department that the health department couldn't pay. I at least, and Jerry supported this, wanted to protect the counties, okay? And I wanted to do that by creating a truly separate legal entity that Michigan law recognizes under the Urban Cooperation Act. So we've never seen that situation, but the very issue that you raised was a concern that I had and that Jerry Chase had. And it's one of the reasons, my friend, that we drafted this agreement.
Any other questions?
May I comment? I just wanted to point out a couple of things about the district health department, and the reason that district health departments are a common theme across the rural parts of Michigan and partnerships between small counties is partly the economy of scale. Linda in her public comment mentioned our dental clinics. When we started those dental clinics in 1991, this is a good example of how a system often works better than one entity. If you have one dental clinic and you lose your dentist, you really, lost your services for people. People can't get services, you can't pay your bills. If you have a system, you're able to utilize other staff, you're able to utilize other resources, you're able to get better prices on supplies and things like that. And so the 90-year partnership that this health department represents between the counties has been an ongoing example of creating efficiencies and increasing the level of innovation and excellence that we've been able to provide across those counties. Our regional lab is another great example of that. That lab doesn't belong to any county. It sits in Otsego County. It does not belong to Otsego County. It belongs to the partnership of counties, and it serves all of northern Michigan with a service that otherwise would only be provided in Lansing or Kalamazoo or Grand Rapids or Detroit. And so when the COVID pandemic started, testing was a major resource problem here in northern Michigan. All of the testing resources were going to the areas in Michigan that are heavily populated. And so people from, Antrim County, people from Otsego County would have to drive to Grand Rapids or drive to Detroit to get a COVID test. And so because we needed to find a solution for that problem, we were able to work together with MDHHS and expand our lab, which had been functioning for many years as a water lab, to provide, clinical testing in the form of COVID testing. It's now been expanded exponentially and now includes a mobile unit that will allow us to bring that testing and other services like vaccination out to other corners of our counties. My report today focused on health equity, and this is an important part of that. One of our biggest barriers in northern Michigan is the ability to get around all the lakes and rivers and trees and, get over transportation hurdles to get services that people need. Our home visiting services, all of, if we have an issue with staffing in one county, we're able to cover things so that there isn't interruption of services in another county. So I just encourage you to think about the obligation that each county has to provide public health services, and maybe the efficiencies and some of the pluses that you receive from being part of this 90-year partnership and why it's worked for so well for so long. You certainly get more bang for your buck out of a system than you would out of a single county health department. There's just no other financially feasible way to do what we do now. Our adolescent health centers are another example of that. You know, that is not an essential service. That is not something that that MDHHS is obligated to pay for. It's not something that you're obligated to provide, but it provides services to thousands of kids and families every year that may not get services any other way. And it works because we know how to bill insurance. It works because we know how to write additional grants. The money that we get from MDHHS is never enough to cover everything. And so, you know, we've had to, all local health departments have had to become experts in seeking other funding sources through Community Health Innovation Region and all kinds of other community part. So that you understand that kind of picture of what's happening.
Address it in kind of a service that didn't contrast, that we didn't have those abilities to move monies around for that program.
Yeah, so home health and hospice, you know, was a division that was part of our health department for a very long time. Department provides in all different age groups, from birth to death and everything in between. Over time, the provision of home health and hospice services, skilled nursing and therapy services became part of more of a healthcare system kind of world, became part of the private world. And many different kinds of home care agencies emerged, hospice agencies, hospital systems had their own. And so over time, what happened was health departments were starting to compete with the private industry to provide a service that actually, in the end, was over time better served through the private sector. And so as much as our community loved, and you know, it was a deeply appreciated and deeply held service that we provided to the community for many, many years, we had to make the difficult decision to understand that we didn't have a system anymore to support that service. We didn't have other means, other types of services within that kind of enterprise to lend resources to it. It was simply, you know, a part of regulation and complexities that emerged, that we weren't able to compete in an effective way and be able to continue to provide that service. We had already really reduced services in Otsego County. It was starting to just be able to be available to the residents of 3 counties. And so all of those things, you know, came together over time and dictated our decision to eliminate those services from the health department and let them be provided by the private sector. So I think it's an important example of when you're trying to do one thing on an island, it doesn't always work.
Any other questions or comments, Julie?
I have a comment. I have not heard anyone say they are unhappy with the services provided by the health department. Everything that I hear, the phone calls that I get, it's about personnel or a person. Sorry, Lisa, but that's what I hear. The arrogance. And I don't think it had to happen.
I would echo Julie's comments in that I don't believe any member of this board has complained about the services, although I think there are services that are currently offered or money that's currently being spent that is not tied to the essential services we're required to provide. But truly, all of the negative comment that we've seen since September have been initiated from the mask mandate and from the frustration that people in our districts have been experiencing because of that.
And there's two sides to that. You know, there's people who are upset about the mask mandate. There's people that are thankful for the mask mandate. Ultimately, we have to have somebody at the helm. We have to have somebody making those hard decisions. Whether we agree with those decisions or not, the placement of that decision is in that person's hands, being our health officer. But disrupting the health department structure at the top, as discussed last time, we talked about the health officer position as well as the medical director position, being those are our top two positions. And the things that they oversee on a day-to-day basis and the services and the structure, it is not about one decision and one person. There is a multitude of decisions that are made every day that aren't about the mask, that aren't about COVID. It's about the ongoing operations of the health department.
But when I took this appointment, immediately after I accepted the appointment, within probably 10 days, I had literally hundreds of people contact me in favor of and support of the health department. And I think that to direct personal attacks at a staff member of the health department because someone is opposed to a mandate, I just think that's totally misplaced. We have somebody who is a professional who makes a professional decision based on professional information and the best information that she has. And if people want to disagree with the mask mandate, I think that's fine. But I just think it's cruel, and I think it's unbecoming of this body to make personal attacks against a professional.
Who's making the personal attacks?
Well, I heard something about arrogance, and I just think that that's unfounded.
We're reflecting what people are dumping into our email boxes. To suggest that we should just say, oh, everything's rosy, let's keep marching, is not representative of the people that we were elected by.
So you're getting people that are opposed to a mask mandate, and so you should express their opinions if you want to do that. But I don't think it's fair, and I don't think it's even humane to bring up in public meetings personal critiques like arrogance and that sort of thing. I don't see it as arrogant. I don't see someone doing their job to the best of their ability that they're authorized to do as arrogance.
Authorized to do, but the majority of health officers in the state of Michigan have not taken the same action that our current health officer has.
Well, that could be there's lack of any number of things or any number of reasons to go into that. But I think we have seen time and time again demonstrated justification for the mask mandate.
So we'll have Lisa talk to current COVID status, current status, and the numbers that are played into that. I believe you had some discussion at committee level regarding that. As far as, the comments made are very specific to one decision. And I think that the comment about services and people are happy with the services, but those services are a result of a coordinated team effort and leadership. And that has been for years and years. You see where we have James Sunmacher at the helm of the regional planning. That's not required as part of your 8 essential services. But it's a leadership position that this department chose to take on in order to coordinate services among the region, because we are a regional health system that, let's face it, there are underserved population and able to, as a leader has done in the past and would like to continue to do, like to move forward, quite frankly. And vision by the health officer is one that she made. It's her statutory duty. But if that were not, if you take that apart from all the other things, we still have a lot of things going on and a lot of things to get done. And I think, we have 150 employees, and not every one of those employees are working on COVID mask mandates. So I think this board needs to look forward and how we maintain those services and how we provide that leadership at this level as well. So that would be my concern, is this board move in a positive direction. We have a system in place that, for all intents and purposes, it's utilized. Services are utilized by the health department. Even COVID services are utilized by the health department, whether it's testing or vaccines or coordination of information to the schools and businesses in our community. So there's a lot that goes on, and I invite anybody who has any questions, certainly can speak with Ms. Peacock, Dr. Meyerson. If you have legal concerns, you can bring them forward. We can speak with Ms. Fogel on those as well, as far as their structure.
I just clarify one thing that you said. You mentioned the community health needs assessment that Jane Sunmacher currently leads. And that is, I encourage you just to look at the LGE booklet, the PDF that Mr. Young referred to during his presentation at the last meeting. There's a grid in the back of that. We talk a lot about the 8 core services. The 8 core services are related to the essential local public health services funding that comes from the state, that the counties are, there's supposed to be a 50-50 cost share between the counties and the state. And that is the funding that Laura from MDHHS is referring to when she's talking about a penalty. Those are 8 of our services that are required by, it's in the boilerplate language of the state budget. There are basic services and there are also required services. Basic plus essential plus required equals mandated services. And in the back of that booklet, there's a grid that explains all of those services. One of the functions that we're required to do under the public health code that isn't part of the 8 core services that are named in the state budget language is a community health needs assessment. We have to assess the needs of our community and we have to base our services on that data and the current needs of the community. That's why some services are developed that may not fall under those 8, but they're still required in some way by some, there are different statutory requirements, different regulatory requirements. Some of the services that we provide in environmental health are provided through, they're required by another entity, but in Michigan, local health departments have a contract with that entity like Eagle or MDARD to provide those services, like, food inspections and water, sewage, all of those kind of things. So there's a lot of complexity to that picture. It's not just about 8 services. And so as you're considering your options, which you have every right to do, just, keep in mind and ask questions about that, because I think it's important to understand what's currently being provided so that you could be able to maintain that. There's hundreds of minimum program requirements for each of those services that we have to meet.
Madam Chairman, I just have something to say. I think I'm sitting here listening to everybody, and I'm really happy that Scott and Matt had their discussion. I think it's really healthy for all of us, because we aren't supposed to be yes, yes, yes all down the line. And I'm glad that we brought this out, and I'm looking around to see how different we are. Well, look at that side of the table. They have their mask on. Look at this side. We don't. We have the right to do whatever we want to do. And I am so thankful that we do have the health department. I've been around for quite a few years and seen how they work and seen how it didn't work. If they have a problem, it seems like they all kind of come together. And that's all that we need to do as the board. Work together. You don't have to agree to everything Scott says. You certainly don't have to agree with everything I say. But try to work together and get our problems out there. Let the health department know what's bothering you, what is really what we should be concerned about. And let's just get together as a committee. And I'm thankful that you said what you did and you said what you did. It's showing everybody else that yes, we are human. We aren't perfect. And we set up here for the benefit of all of the communities that we live in. And that's all I have to say.
Thank you, Shirley.
Thank you.
Yes.
I agree, Shirley, with everything that you've said. I like that you said we need to not be yes people all the time. That's very important. Matt, what would you have us do with the telephone calls that we receive, with the emails that we receive? We cannot ignore those.
Understand that? So
if that word is used to me 200 times, do I ignore it?
oh, you can do what you want.
I think the
But I
question
think
here,
Shirley's point that we need to move forward with the business of the health department is valid. And so that's what I would recommend doing.
it seems there's a lot of conversation that takes place outside of the board. And maybe the board needs to have the conversation here. And I think that started with discussion about a letter that was issued by 4 members of the board versus coming to the meeting and having that discussion that you would like to issue a letter, or you would like to ask for a rescind, or requesting a special meeting. And I think that's what we did not request, a special meeting. There was actions that were taken by members. And so where we'd like to be, where I'd like to be at least in this situation, is moving forward. Let's have the discussion at the board level. Certainly we can have those discussions, get more information if you have a concern. Quite frankly, Mr. Pallarito, I had no idea there was even a draft agreement out there. But certainly if there was a draft agreement, we'd find out if there was a finalized agreement. That was work that was done and researched, and why Jim, said, hey, I was part of that. I can give you the history. Great.
And I thought
Why-
that was a pretty darn good agreement. It
But
lays
why
out a plan for discussion.
But why spin our wheels outside of it? Why don't we bring it to the board, have that discussion, or ask the question so we can get the information to the entire board? And why perpetuate rumors or discussion outside of the board when we all can have that conversation and get the information and ask the questions together so we have that understanding? So that's, when you do get those concerns and your questions from members, and I got, oh God, good Lord, I got a ton of emails as well, both sides. My personal receipt was more in favor of health board and mask mandates versus against health mask mandates. Okay, that just happens to be my receipt of. I did get the phone calls, I did get the emails, but we had that discussion. How many were received by public comment card? We've had those as well. And certainly, if you're getting those comments, it's appropriate to have time if anybody disagrees.
Well, with due respect, Madam Chair, we did have that discussion. It resulted in a 6-1 vote to request her to rescind the mandate, and it went nowhere.
That was a culmination of other activities that happened prior to. And again, we did have that, and we were advised that it was not within our authority. So
Correct.
again, we should have had the entire conversation before coming the way we did in our prior meeting, is what I'm saying. Let's have a meeting to discuss that versus an action or a movement towards an action prior to having the discussion.
I also would make the comment briefly that you, Mr. Kuntz, and Ms. Roloff have all suggested that we move forward. I like that thought. However, when we are served with notice that we're going to be sued by our public health officer, that creates a very difficult environment to move forward.
You were served with a preservation notice. And my understanding of a preservation notice is that if in fact litigation were to come about in the future, that any potential evidence would need to be preserved, which basically means any communications, any notes. It's a pretty broad preservation notice.
It's a request.
Okay. And I'm not the lawyer here. I'm just,
We can talk about this more when we go into
closed session. So everyone here was given a preservation notice. And it's in, so
My point was moving forward, given that preservation notice even, that creates a very difficult environment to consider moving forward.
Madam Chairman, I'd like to point out that it didn't start with that. That was an action, a logical outcome from what was characterized by some people as a near riot at the Charlevoix Public Library meeting, which I did not attend, was never a part of this. But I think when we write the history, we have to go back to the beginning. The letter written by 4 members who made a demand in public was not a legal document. It was 4 individuals who signed their names as county commissioners, but to the best of my knowledge, certainly in the case of the member from Emmett County, was not authorized to act as an Emmett County commissioner to sign that. And away from this meeting, I have no authority with regard to the Board of Health. I simply come to a meeting, a public meeting, which is properly noticed, at which a quorum is present, and I can vote. But that letter was out of the normal legal bounds there. So when we, the issue of legal action is important, but it followed other things that were, disturbing. I mean, what I've read, I'm not gonna, since I wasn't there, I can't cure. I found it pretty disturbing, but I think things started, it is hard to move forward. I think we have to, but we also have to recognize that the history is a little longer than that we might want to think about.
So we can talk about that preservation notice further in closed session if you have any questions or concerns.
Jim's raising.
Yes, sir. Jim?
Yeah, thank you. I'm trying to unmute. Did that work?
Yep, we can hear.
Okay, I also meant everybody. So, if I might, I ask your indulgence in allowing me to provide some legal advice based on my experience. I think this is an excellent discussion. As a result, it motivated me to stick my neck out. Let me provide some advice that I believe is legally justified. First, I understand and I agree with elected officials should not always say yes. Is it appropriate to question? The answer is absolutely yes. And the question is, how then do you do that? How can we move forward consistent with the law, but also consistent with the concerns that many constituents have raised? Here is a suggested path. The decisions regarding emergency orders, the mask mandates, by law must be based on a person's professional judgment, which in turn is based upon medical data and other relevant facts. It's my recollection that at the last special meeting, a committee was formed that could, without taking everybody's time, but as a committee, monitor the factual basis and the evidence that are being considered by the health officer and the medical director that either justify or don't justify or justify changes in the existing mask orders. And that committee can be kept updated on the data and the facts that are being used to justify that professional judgment. And that does not stop them from taking that same data and saying, is the data that we've been given accurate? That's legitimate. And from checking with other medical professionals if they see fit, saying, given this data, is the professional judgment that's been made by the health officer and supported by the medical director, is that justified? And if not, why not? And if it's not justified, that can be discussed at either a committee meeting or actually at a board meeting. Regarding the prior vote to rescind, that, as a matter of law, was simply, for lack of a better term, a statement of preference. Under the statute, the vote to rescind had no legal consequence. But, as I say, you still have a right to monitor and move forward by monitoring the basis. Things may change and as I try and follow what's happening across the country, I mean, I see in the Midwest that cases are increasing. That may change, and now we have another variant that's a factor. But it's my hope that if you follow a path like this, that the preservation notice, for example, will become irrelevant. And if I might, I've had the pleasure of working with excellent health officers. I remember telling a board of commissioners one time, back when Jerry Chase was there, that of all the mayors I work with, the city managers, township supervisors, whatever, that the health department has one of the best. And also, the fact that may up some sort of waste of taxpayers' money, but I won't address that. It's not relevant to this. But thank you for saying, how do we move? I believe it's legally justified, and that allows you to tell your constituents, whether they're pro or con, the basis for the decisions. And I also will be honest, if there were a number, based on the facts that our professionals are making their judgments on, if other medical professionals would disagree, I think the public has a right to know. Then the question is, what can be done if that's the case? And let's deal with that issue if it arises. In the meantime, thank you for raising the question, how do we move forward? All of you seem to agree on that. Let's put history behind us, and please, as I terminate my career by working with the health department, please let me know in my heart that this agency that I've cared so much about is moving forward now in a positive way, okay? Trying to move forward. So I thank you. I will be here to help however I can. I care about all of you. I care about this agency, and the quality of services we've given is excellent. I mean, I helped create the dental clinics and work with its transition. That's been fantastic, and it's just one of the many reasons that I consider this health department one of the best public entities that I've had the pleasure to work with. Thank you for listening to me.
Thanks, Jim.
Sheriff?
Yeah, Jim, if I could just, I'm on the committee to go over the bylaws, and in the minutes that we approved, I've read quite a few minutes in my day, and the motion at the last meeting to recognize the violation of the bylaws, but to continue to hold the meeting. There's a couple other instances where the bylaws have been violated. Could you answer the question, is that a problem? And if so, how, and what's your recommendation as far as following the bylaws moving forward?
My friend, I did not prepare those bylaws. I don't recall ever being consulted on the bylaws, and I really need to look at the facts, look at the bylaws, see how the bylaws were applied to the facts. Would I be happy to answer that question? Yes. I just can't do it off the top of my head, my friend, because I don't have enough information. Okay. But I do think we need. I will be honest, I still think an intergovernmental agreement is a good idea. I still think intelligently written bylaws are a good idea. And this is a classic example why we should have it. And I think obviously dealing with this COVID crisis takes top priority. But after that, in terms of organization, my friends, I really think we should address these issues.
So just speaking to your concern about bylaws, and Jim, just for background for you, one of the concerns was we were having the meeting at Antrim County and not, at our normal place in Charlevoix, being the health department in Charlevoix. Given that we had some safety concerns, our bylaws didn't address outside of having a meeting to address a different location or different times. So we identified that there were some areas that lacked. I think we identified that in our own counties when we first went on lockdown for COVID. How do you allow for electronic meetings without having a meeting to say you can have an electronic meeting? And it kind of went around and around. So we recognize that there were some issues there. Ultimately, a lot of those concerns were allayed by and one of those concerns was Emmett County having a resignation. The state law trumped our bylaws, and that was right in our bylaws. And so there were some intricacies in there, but again, that's why we're looking at bylaws, so that we know that we have some issues and some things that we need to be able to identify, so that if we're unable to meet at a location provided, how can we change a location without having to meet? Because that's obviously, if you can't meet there, there's a concern. And so hopefully the committee has that discussion a little bit more thoroughly, and that's why it's been referred to committee. Any other questions? Yeah, Julie.
Karen, I have one last comment, and that is, Lisa, before you issued the mandate, I have to assume, and I'm positive, that Josh came to you at some point and said, this is becoming an emergency. We're looking at numbers that are getting out of control. Why did you not call a special meeting of your board to do what we are supposed to be doing? And that is to advise and consent and talk about this. We talked today. Look what we're talking about, very open, having these discussions that are necessary. Why did that not happen then? Had that happened at that point, I don't believe we'd be sitting here today. That's all I have, Karen. I'm done.
And if you so choose.
I can state what I've stated in the past, and that is that there was an urgency related to the imminent start of school. Some of our schools were starting on Monday. And as you know, we barely had enough time that day to get that order done and out, which is the reason that it went out early in the evening on Friday, because we worked on it all that day and all the day before, in between calls from superintendents and community members who were concerned about starting school without masking. And Dr. Meyerson and I talk every day, pretty much without missing very many, about the current status. And we spoke with the Program and Evaluation Committee about this the other night and went through our rationale for issuing the order. And I also acted in the same way that I've acted with legal counsel in issuing previous orders. We didn't call a special board meeting. It's a step that isn't required. It's a step that could potentially influence my decision in a way that it's not supposed to be. The decision is supposed to be influenced by medical information. We went forward in the same way we've gone forward with other orders. They're emergency orders because there is an imminent emergency and we needed kids to start school with masks.
So I have a question. Well, you stated that, and I don't know if you know the answer to this. So many schools contact your or school boards or superintendents or however that worked. what prevented them from issuing a mask mandate in their schools? Anything?
Their school boards didn't adopt those policies.
And they're elected by the people, I believe. So I would assume that if the people had a problem, they would either take care of that, or it seems like we're skipping a process that the superintendent seemed to have the authority to go to the school boards and do the same thing that the health department did. Why didn't they follow up? Are they lacking in their duties at this point? I guess is my question. And that's not a question for you. That's just a comment. But
I can answer that a little bit for you. I think that for the same reason that maybe she didn't want to consult us for our opinion, is that the school boards were faced with that as well. They didn't necessarily have a medical background, but they definitely were subject to public opinion. And so let's face it, public opinion biases you one way or another. And that in an emergency health order and a health-based order, which this was, and there was data that supported it, and being a statutory duty to uphold the public health code, I would argue that even the best intentions are influenced. And so there was a data process used for the health officer. There may have been that same communication all the way down the line, but ultimately elected board members are influenced by public input.
so what you're saying is we shouldn't elect school boards because they're influenced by people and weak and inefficient, and we should have bureaucrats run it all.
I did not say that, first of all, sir. Second of all, it's a medical.
To do their jobs, and I think that's why parents are upset.
It is public health.
If they need a mask mandate, they've hired these people to do their job, to require masks in school. It's as simple as that. And to pass the buck on down the road, say, well, that's a tough decision. I don't want to make that one. That'll be unpopular. May be true, it may not be, but the superintendent clearly could have issued a mask mandate in whatever schools wanted to have a mask mandate. So, and that may be my opinion, but that's how I perceive it.
Well, and I think that opinion is shared by the governor and the MDHHS because they've refused to issue a mask mandate and have said, let the schools make the decision.
They've actually said, let the schools and local health departments make the decision. They refer to local districts, which means health department districts and school districts.
There is a component of public health, and the school boards are not mandated to carry out the public health code, but the health officer is. And there's your difference in that. I don't want to argue back and forth. That's not my intent at all. I'm simply trying to address your concern.
Thank you.
But we do need to continue and move on. Is there any other?
Madam Chairman, I have the bylaws, 3 pages. Julie made the comment about advise and consent. Show that to me in the bylaws.
It's not in there,
Exactly.
but it's in the bylaws of other of the counties.
This is the only one that we got.
And we're working on bylaws.
Well, bear in mind that what you are asking the staff to do is not in our bylaws.
It's also not our role to advise on emergency health orders.
It really is.
That is one particular statutory duty. So that while we are here to advise about county matters, about internal policies, about programs that we offer, that is one area that does not pertain to this board. And that's where we have to have that understanding, and that emergency health orders are not in our legal authority to to say yay or nay. That's entirely a statutory duty. And I use the analogy, the clerk, I can't tell the clerk to run an election or how to run an election or not to run an election because it's entirely her statutory duty. So it just is what it is. On other things, yes, we are to advise. And I think going in the future, if there were something that we knew was going to be as politically or community charged as this, that I'm confident we'd have a conversation prior to the issuance. And we've talked about that where Ms. Peacock will be calling each of us or notifying us by email or whatever it needs to do. And we did get that communication prior to the public getting the communication regarding the changes to the statutory mandate. So, and we all agreed upon that and how that would move forward.
The whole point of having a board of health is to have health professionals in place to make informed decisions on public health. And I think it's important not to confuse, I think we're lucky to have that situation. It's important not to confuse courage with arrogance, because you need to have somebody that is willing to make the hard calls and based on informed decisions. And that's kind of the basis of what the whole health department is about, in my opinion.
So with that, we're going to move on to Ms. Peacock's report. If you would touch on current status regarding COVID-19 and data.
Sure.
And then we also have your report that was written and let's hit on that.
Okay, sounds good. All right. Well, I see a written report in the packet, which I won't reiterate that. I'll just point out a couple of highlights. One is that I again provided an image of the 10 essential public health services that fall into those three major categories of assessment, assurance, and policy development. And this month, hopefully you noticed through the director's reports, all of the different ways that we think about and address health equity. I included an image that is, I think it's really understandable. And so when we talk about equity, people sometimes think equality and think that, what we should try to do is make sure that everyone has the same resources and, the same level of assistance or whatever to help them meet their need. And the image really shows the difference between equality versus equity. I included the CDC definition of health equity. And really what it comes down to is it's not a certain program, it's not a certain service, it's a lens through which we look at everything we do. And so when we're providing public health services and equity is important to us, it's included in our mission statement, which was updated by the Board of Health a couple of years ago. We have to think of things in that way, that not everyone starts from the same place. And sometimes those services need to be customized, and people need different levels to be able to achieve their full potential, whether it's health, achieving their education, all of those things are part of public health. We know that, completing your high school education is one of the most important drivers of future health. And so those are the reasons that equity is important to us and is part of everything that we do. So as you look through the director's reports this month, I hope that it kind of pulls all those pieces together for you. In terms of an update from the health department, we did provide a COVID data update to the Program and Evaluation Committee that met on Thursday night. And I think that Commissioner Rubing is going to give a little update on that when it comes to that part of the agenda. And I'm happy to share that PowerPoint with everyone. I can email it to you. We had a good discussion about that and then moved on to working on the bylaws. But I wanted you to have a sense of the information that Dr. Meyerson and I review regularly, not only at the beginning when we issued the order, but every day and every week since then, to determine what is happening and determine is it still justified? Is it still an important protective measure? And we think about that all the time. Currently, what is happening is, across the state, risk trends are going up. We have breached the level of average daily cases that we've ever seen reported to the health department each day. This past full week, it was 84.57 cases on average being reported every day. Each one of those case investigations can take up to an hour. And so we have multiple temporary staff pulled in, working on those case investigations. Our nurses are extremely stretched between case investigations, testing, and providing vaccinations, in addition to all of the other public health services that we're still providing. Last week, we had 6 deaths reported. We are seeing, typically almost a death a day, sometimes up to 2 deaths per day. The pandemic risk across the state is going pretty much on an upward trajectory. The state positivity rate went up a little bit this past week to 20% from 18%. The case rate went down a little bit from 549.5 weekly cases per 100,000 to from 557.9 the week before. Hospitalizations were at 435.3 per million, and that is up from 400.5. Traverse City region, our positivity went down a tiny bit, 0.2 of a percentage point, to 21.7 from 21.9. And the case rate went down a little bit as well, 489.7 from 573.1. That's the first week that that's happened in a long time. So we'll continue to watch that and see. Those numbers certainly are affected by the number of people testing and a number of other factors. So again, we look for trends, not any certain one data point. Hospitalizations are lower than the state this week at 394 per million, down from 405.3. And that is the first time in several weeks that the hospitalizations in our region have been lower than the state. So that is another good sign. Our counties, everybody went down in both indicators except for Emmett County, which went up this week in both positivity and case rate. And just of note, their case rate was the highest that they've seen throughout the pandemic. All of our other counties hit that point in the last couple of weeks. So case rate in Emmett County was 505.8. Weekly cases per 100,000, up from 338.2 the week before. We're seeing outbreaks, a lot of employer-based outbreaks, and so low numbers of cases, 2 to 3 cases per outbreak. Most of them are less than 5. But this has a really big impact on businesses. For every case, we're seeing close contacts who have been exposed at work. And that means that employers and businesses have several employees out due to either isolation or quarantine. We are certainly seeing that not masking in the workplace is an issue in these outbreaks. Most consistently across all of the outbreaks, we're finding that people were not wearing masks. So that is also important to know. It's also important to know that unvaccinated people are representing over almost 90%, 85 to 90% of the cases, hospitalizations, and deaths. And that's across the state. So this is certainly, emerging in the unvaccinated population. Vaccination rates are going up. The 5 and over population at the state level, which is the entire eligible population now, is at 61.4%. In the Northwest District, our 4 counties is at 65.3%. We have nearly 15% of 5 to 11-year-olds vaccinated. 2 counties higher than 2 others. Emmett and Charlevoix are a little higher. Otsego and Antrim are a little lower, and that's true across all age groups in the vaccination status. 12 to 15-year-olds, we have a little over 40% of those kids vaccinated, and 16 to 19-year-olds, we're at over 50%. So we're getting there. We hope that parents will seek vaccination over the Christmas break, and certainly that's a protective factor. That is one of our most important protective factors, and certainly an important issue when it comes to looking at the order and the future need for masking. Currently, all counties in the state and the entire state and all regions are in a high transmission level, which does continue to be consistent with the CDC guidelines recommending that schools implement universal masking whenever we're in high transmission level, and recommending masking for everybody indoors in public places. So what else? I wanted to update you on, I guess I'll also tell you about testing. There's a lot of strain related to testing. We work with the HANU Management Group, which is a contract that we can get access to through the state. They have come to do testing in each of our counties except for Emmett. We have not been able to get them. They're experiencing staffing shortages as well. But they're in Gaylord on Mondays, they're in Central Lake on Thursdays, they're in Charlevoix on Saturdays. And they're typically doing 50 to 100 tests per day when they're there. And they're seeing about a third of those tests being positive. So there's still, a high demand for testing, a high demand for a high positivity rate. The hospitals, we work with them each week and speak with them very, very frequently. Munson this week just reported that their ICUs continue to be incredibly compressed, and that is true across the region and across the state, especially up here. We haven't had an available ICU bed that's been open in quite a while. The OMH reported last week that half of their inpatients are COVID related. So they're seeing more and more. Munson Healthcare has 149 COVID inpatients across the system. That's the highest number that they've had. 88 of those are at the medical center in Traverse City, 4 in Charlevoix, 16 in Grayling, and 12 at OMH. I didn't talk to McLaren this week, so I don't have their current numbers, although they do send us a report every week, and they're same thing. They've reopened their isolation unit and their ICU is packed. The hospitals reached their deadline yesterday for their vaccination mandate for employees. Charlevoix Hospital is the only one that I spoke to about the status of that. They lost 2 employees that reported they were leaving because of that, and they have replaced them. They've been able to replace them already. So that was far better than they thought it would be. They continue to be in the red status, which means that their resources are overwhelmed. And they're doing things like moving staff, again, that system kind of concept. They're moving staff from hospital to hospital to meet the most urgent needs. They're canceling elective procedures and just, kind of reassessing every single day what they can do. They're trying hard to keep up with the administration of monoclonal antibodies. Both of the hospitals talk about the strain on staffing also affects that. They also have some supply chain concerns with that. In that there are only certain amounts that are allocated to each facility, but they're doing everything they can to try and expand the opportunity for that. That's another really important glimmer of hope on the horizon, is that we would have additional early treatment options that people can receive on an outpatient basis to hopefully prevent hospitalization and death. So I think that's everything I had to say on COVID. I also included in my report that we did receive the mobile unit that was funded by MDHHS for the lab. So we're looking at, again, staffing is our constraint. As soon as we can increase some staffing, we will be able to do some testing. And one of our first targets is Emmett County, because it's the place where we don't have HANU testing. And so we spoke with Mike Reeves yesterday. We think we could use the fairgrounds as a place to bring the mobile unit and do testing out of there. So that's sort of our plan right now. We continually assess how many numbers we're seeing, what the demands are, and how can we best meet them. I wanted to talk to you a little bit about the lawsuits. So there are 2 current lawsuits pending. One was the lawsuit that was first filed in Otsego County in probate court. It was dismissed based on subject matter jurisdiction, and was refiled in circuit court. We have a hearing scheduled. The temporary restraining order ex parte motion was denied by the circuit court judge, and then a hearing was scheduled for December 17th. So we will be attending that via Zoom, I think. There was last week a lawsuit filed in Emmett County. I do have to say, though, that we have not been served with those papers. The attorney notified our attorney, who notified me, but we have not received official service of that lawsuit yet. So therefore, there is no hearing scheduled. It's the same attorney, a different plaintiff. This plaintiff is called the Concerned Citizens of Emmett County. And very similar lawsuit seeking injunctive and declaratory relief, asking that the school not have to follow the health department mask mandate. And I don't know, Lisa, if you want to say anything more about those lawsuits.
Was that in circuit court as well?
Yes.
Circuit, yes.
Circuit court dynamic. There is tentatively, although it's disputed, a December 22nd hearing. I forget the time, although we've asked for that matter to be adjourned because both myself and Laura Genovich from Foster Swift have conflicts with that date. So my assumption at this time would be that the matter may be adjourned until January, particularly since we have yet to be served. So that's all I have to add.
And then the final update I had for you was, we've been talking at different times about the MMRMA insurance and the exclusion that they added to our policy in July for anything related to communicable disease, which is obviously a problem for health departments. And so we have had several conversations looking into that. They are working on it. The executive director of MIRMA has said that they are seeking an alternative plan for health departments, which may come in the form of an endorsement, so that it sounds to me like it wasn't intended to, they didn't really understand that it was going to affect all of their local health department clients in this way, and that it's basically our core work that we do, and it just really isn't acceptable that we wouldn't have coverage for that. And so lots of health departments have been engaging in advocacy, including us. I spoke with our local agent recently. He also reassured me we've done some shopping to get some additional quotes. It takes a really long time to put together an insurance quote for an agency the size of ours and all of the different 5 years of history that they need to see. We will still be getting those quotes, but I have renewed because our policy ends December 31st and it takes time. So we've started that renewal process. They've assured us that they're working on that going forward. And one of the agencies that I reached out to is the agency that provides our health insurance. And I asked them for a quote, and I got a call from their agent who used to work for MMRMA, and she called and said, honestly, I just want to let you know that we cannot provide anything close to what MMRMA can do for you. You really are in the right place for that. If they say they're working on it, I completely believe them. I'd love to be able to quote you on this, but I think it's a line of business that we just really can't compete with them on. So just know that we're, doing all of our due diligence to make sure that we check into all possible options and also advocating for change with MIRMA. I think that's it. Is there anything else you wanted me to touch on, or anybody have any questions?
In the Emmett County case, do you know who these concerned citizens are?
No.
Do they name people?
No.
Are they required to name people?
Well, that is an issue in the Otsego case that will be addressed because we filed a motion to dismiss the case based on standing. And to put it in simple terms, you have to have an injured party. So where is the injured party?
Yeah.
So without going into a lot of detail, I can forward that brief to you and you can review it yourself and have an understanding about why it's important under Michigan law, to have a true plaintiff. And,
Just had a question on vaccination. Had a friend, had a family member pass away at a Beaumont hospital, and they're classifying the person was apparently vaccinated, but since they had not had their booster, they are now classified as unvaccinated. Is that, what are we using as what's our definition, I guess?
Yeah, good question. Yeah, so they look at it in terms of fully vaccinated or not. And so what they are calling it unvaccinated at this point is someone who's not fully vaccinated. Do you want to elaborate on that at all, Josh?
As far as I know, that definition is just getting your primary series, either 2 doses of an mRNA vaccine or the one Johnson & Johnson. That's fully vaccinated. Getting a booster dose, although recommended, doesn't change your status.
Okay.
Two doses, 2 weeks after you're considered,
Right.
not immediately. So you have 2 weeks after your second dose. Right. Just want to be clear. What else, Jared?
Yeah, just when you look at something like COVID, like we got, just wondering if you're looking at other things. I know they've seen some studies in other countries with ivermectin, and just wondering, I mean, I know it's really cheap. You can give somebody a dose of ivermectin for about 22 cents. I like to see all the tools in the toolbox. So maybe it would help 4 people in 10. Maybe it would help 2 people in 10. But if so, it's not going to hurt them. So just wondering if you've done some research on that, and maybe Josh wants to talk to it. I don't know.
Yeah, there have been a lot of studies looking at ivermectin and other medications in their ability to help reduce morbidity and mortality from COVID and other viral infections. And I've looked at those studies, and there's groups that have looked at those studies, and right now there really isn't any good evidence to support their use. So the recommendation that I see from the Infectious Disease Society of America and a lot of other groups is that really that medications like ivermectin really should only be used if they were part of a good clinical trial. But the few good studies that are out there really aren't showing that much benefit. But that's not to say there can't be some benefit, and should it be studied more, perhaps. But I can't see recommending it to anyone at this point, because I think we have better alternatives out there. We do know there is medication, like monoclonal antibody treatments that have been shown to be extremely effective if they're given in a timely fashion, or for people who are sick and in the hospital. There's the remdesivir, and there's really inexpensive medication, the Decadron, the IV steroids that really helps improve your clinical status, and those are being used. So things like ivermectin and some of the other medications or treatments that have been touted, there's just no good evidence to support their use. I wish there was.
Have we thought about doing a study?
I think
I don't know.
been.
I don't know
There's
what
been
the
a lot of
parameters
studies.
are, or the requirements. I'm sure you can't just say, every other one. I mean, people's when you do a study on people, you have to have consent, and you get lots of things. But I'm just curious if the thought process has been there.
Yeah, not on my behalf. No, that would be something that my partners in healthcare are treating physicians. That would be a question for them. But I know there have been studies, and there are ongoing studies still. At this point, there's still studies going on.
Do you want to talk about the side effects maybe of some of those medications? As we all know, we see the commercials, this will help you with this, but these are all the possible side effects. If you ever listen to them, you don't want it. So the outcome has to be better than the detriment.
The same can be said for the vaccine, though.
Then there's actual studies that are posted on that. So there is something, but I'll defer to Dr. Meyerson to address that maybe a little bit.
Well, ivermectin, when it's used appropriately at the doses, for its indicated, diseases that it treats, is really a pretty safe medication. It's pretty well tolerated. When people use it in high doses, there can be issues with toxicity to the body that can cause severe side effects. But like any medication, if you take way too much of it, can be dangerous. But overall, it's a pretty safe medication. Again, used at appropriate doses. But we unfortunately, people sometimes think if one is good, two is better, so go with 5. And with anything, too much of something can have severe side effects. So why you should always only take things as indicated and at the appropriate dose.
And then another question for Lisa. So the comment from the public has been, well, if these masks work so good in schools, why are we closing schools? And so there was several school closures the last couple weeks just before Thanksgiving. Should we address that?
Yeah. So we don't close schools, typically, unless there is something really out of the ordinary. Typically closing a school is the decision of the school administration. And when we have spoken with our school administration about recent closures, they always relay that it's related to multiple factors, not just the number of cases that they have. It can be related to not having enough staff, and I'm sure Matt can relate to this, not having enough staff either to drive the buses, teachers, support staff, serving lunch. All of those different things can just provide a perfect storm that can make it difficult for them to operate. It's also cold and flu season, in addition to a high transmission level of COVID. And so when they have a large number of students and staff that are out sick with whatever they're sick with, it can affect their ability to operate. Sometimes they need time to do the contact tracing that helps identify exposures within the school so that we can make sure that people get isolated and quarantined appropriately, not too much, not too little. And so that can be part of that factor. I think that there is plenty of emerging data that shows us that schools who have mask requirements are 3 to 5 times more likely to have, or schools who don't have mask requirements are experiencing cases and outbreaks at a rate that's 3 to 5 times higher. And so, that data leads us to the conclusion that if we weren't masking, we would certainly be seeing more absences, more closures.
And is your contact tracing showing correlation to community spread or institutional?
So both local and state data are showing that not only are school-aged cases and school-related cases going up, but certainly we're seeing the rates of cases going up throughout the community, which is what happens when we have a high level of community transmission. Both go up. And there's actually I'll send you the PowerPoint that I shared with the Program and Evaluation Committee. U of M and MDHHS have been studying. MDHHS discourages comparison just county to county by entities other than them, because we're not necessarily, when we're looking at those numbers, controlling for all of the other factors that can influence that data. When we're saying this district has more cases and more quarantines than this district does, we don't know unless we do some detailed research if all the cases are being reported, if everyone was tested, if all the other factors that could influence that number are actually happening. So they are doing some controlled studies at the state and looking at that data and isolating out some of those confounding factors. And what they are finding is that from the start of school, when school age cases went up, they went up at a higher rate, but also community cases went up. Everybody else and all the other age groups also went up. So when the risk goes up in school, the risk goes up everywhere and vice versa. So I'll share those graphs with you so that you all have them on hand.
Any other questions? Okay.
Directors are on Zoom, by the way.
All right. Do we have a PowerPoint presentation from Kathleen?
She's not going to be providing a PowerPoint. I don't believe. Everybody was not planning on presenting, but they shared it in the packet.
Okay, so you did have a PowerPoint that was attached. Look like this.
Right.
Wasn't sure if we were going to be sharing it today or not on the screen. So directors are available if you have questions. You had a report from the community health director regarding the Emmett School Health Resource Development, as well as this presentation applied to that. Are there any questions regarding that presentation or the report? It just kind of outlined how that program in behavioral health was developed within the schools and with our partnerships and the different sources of funding and grants, and how it came to be and what it is today.
I will just comment that this Emmett School Health Partnership and all of our school-based health centers have served as a really strong foundation for adding additional school services during the COVID pandemic. Schools have been, not only a huge partner, but certainly have had their world turned upside down, just like public health has in many other sectors. And one thing that has been really great lately is we've been able to add 5 additional school nurses through funding received from MDHHS to work with schools to address the COVID needs of their students. So they're helping with testing, they're helping with contact tracing, they're helping with coordinating, being a liaison between the health department and the school. And we knew how to implement that quickly, and we're able to put that in place very quickly and effectively because of all the experience that we've had with school-based health programs. And this Emmett School Health Partnership has been a really big part of that foundation. And it's unique because it was generated by the community. It was the community that stood up and said, we need school nurses, we need school-based mental health services. How can we work together to get this done, and pulled together a group of community partners, including the health department in McLaren, Northern Michigan, to address that. So it's a great success story.
Great. Thank you.
Any questions? All right. Then we had the Family Health Director reported on the Healthy Futures Program. Any questions on that? Again, all the reports focused on health equity. The overall caption for this month was health equity. Seeing no questions, we'll go to the Environmental Health Services Director reported on the Pellston PFAS response and progress to date. Some upcoming dates that were referenced in there. Were there any questions regarding that?
I'll just say I appreciate it. Obviously, Matt and I care very much about Emmett County and the Pellston Airport and the activities there. I saw a reference to an interest in the part of the local community to put in a water supply. It turns out that Pellston isn't the only airport with a PFAS problem, but it is differentiated from some of the other airports in that everybody around is on a well. And many of them, like Kalamazoo, are on a municipal water system, which isolates them a bit. But I see now, and I have heard this before, that there is discussion at Pellston. There's a great benefit to a municipal water system in terms of economic development. Multi-unit housing can come in when you have a water system. So, but the cost is huge. And I noticed there was a reference to exploring some financial alternatives, but I think it's in the millions of dollars and it's a pretty small village. So that's one fix, but it's anyway, I don't know that you folks have anything to offer on that, except that thank you for your good work. And that is an example of why I, as a member of this group, do not want to become involved in any way with what staff does and its regulatory responsibilities for the safety of that community. And I'm not doing it to be clever here. I just really want to be sure that, and I am confident you folks are looking out for the safety of the Pellston residents who have this forever chemical in the ground. And how this turns out, of course, no one knows. But anyway, thank you for the update.
I think it's a credit to the health department for being proactive in this particular situation, because we weren't the ones who discovered it. It was students and part of their project that discovered it. And once we found out, Scott was here prior to Dan, and right away, we addressed it, we moved forward. They're on a filter system at this point. Ongoing testing is being done. Eagle is a partner in that, but definitely continuing to monitor.
Well, the summary in here was very helpful. Excuse me, I didn't mean to interrupt you. Karen.
No, that's all right. One question I had, some of these on the map that you provided show that there is areas where there's a detection above limit, but nothing else around it was detection above limit or vice versa. Is there a reason for that? Is it shallower wells, deeper wells? No rhyme or reason.
All three, really. Yeah, I mean, there's really a lot not known about how PFAS moves through groundwater, and it's so new that a lot of this stuff is being learned on a day-to-day basis on how it's evolves and moves about in the groundwater. And certainly, deeper wells we're finding are better protected, which makes sense. We're in a pretty much an unconfined aquifer, which means there is no clay barrier or anything that they're drilling through. I mean, it's pretty much all sand and water table. So the deeper you're going in the water table, the better chances are that you're going to have less PFAS in the water or non-detect. We are finding, as I pointed out in the report, and right now we have additional testing going on. MDHHS has committed to retesting because what we're seeing is that even wells that were non-detect 6 months ago, when they retest, some of them come back with detections, and some of them even above criteria limits, or ones that had lower levels are now higher now. The important thing to note is that regardless of their detection level, even if it's below drinking water criteria, they've been offered a filter, point of use filter. And most, people have taken advantage of that. In addition, Emmett County really stepped up, and MDHHS was ending the bottled water program because their philosophy is, and their policy is, once they provide a filter, people have a source of safe drinking water. The problem is that, it comes out in a trickle, a small amount through a point of use filter, at your kitchen sink. And it's difficult to fill up, large pots to cook with and make coffee and things like that. So working with Mike Reeves at Emmett County, they decided to take that part over and continue to provide bottled water as a supplement. And, we definitely appreciate that and the residents really appreciated that, I know. So, so hopefully that answers your question.
Sure, thank you.
Yeah, that was Mike's decision because he knew that MDHHS was going to end the water distribution, and he felt that it was absolutely an important thing to do to follow up with the water supply. It's a village, it's a small town. There are neighbors, part of our community. Many of them work at the airport, which is the source of the material. So anyway, I found your report to be very helpful.
Thank you.
Yours?
Yeah, I noticed since it's been coming through, every time there's more wells that are contaminated.
Yes.
As the report comes through. We've seen PFAS a couple other places throughout the state. Have you done any drawing a circle around, this is what Kalamazoo saw, so, or are we just going to keep testing in a circle around there every so many months? I guess what I'm asking is, do you have a hypothesis of where we are and where we could be?
Well, and this is the same for a lot of environmental contaminants. It depends on the source and how much went into the ground at the site. That really determines the level and extent of the contamination. And I will tell you right now that the initial investigation of this was really focused on the airport, and now they have gone beyond the limits of the airport and into the neighborhood to put in monitoring wells to really use that along with the residential drinking wells that we have good information on as far as like depth and what what was drilled through with well logs. We don't have a lot of well logs because of the age of a lot of the wells in the neighborhood, but through that activity with drilling monitoring wells, and Eagle is trying to determine the extent of the contamination and like exactly how far that is going. And as far as related to other sites like in Kalamazoo, I was involved with a couple in Traverse City, and really honestly every site is different. It's very difficult to draw conclusions or generalized conclusions about how this contaminant acts. It's definitely concerning. It's like someone said, a forever chemical. It does not break down in the environment very well. There are methods that are being tried out to basically remove it or remediate it on site in the groundwater to try to take care of it that way. And it, there's still ongoing, research and development on how to deal with these things. And I think Michigan is one of the first ones in the country that have really kind of tackled this problem. And it is a nationwide problem. I mean, it was used everywhere. So it's ongoing, and things will change very quickly, very rapidly. So I'm very hopeful that like in Paulston, right now the process has started to kind of look for some funds to do a feasibility study, and really the long-term solution here is a municipal water supply. So I probably expounded a little bit beyond what your question asked, but.
Can you, there is a website that Eagle maintains that has all of the PFAS of identified sites. and additional information on PFAS.
Yes, that is correct. And that's if you simply just through a search engine, searched MPART, MPART, Michigan, and that brings you right to that site. You can look at every single PFAS site in the state and all the details about that.
So when you talk about, one of the factors for Pellston was that it's sand. There may not be a risk to wells because there is a clay barrier at another site. And so it's not detected because they have clay. And they delineate some of that information for you on those. So if you have a particular interest in the area.
Yeah, and the other thing to point out too, which this happened in Elk Rapids actually earlier this year, is that every time a commercial property is sold, there's a environmental assessment that's done. A baseline environmental assessment is what it's called, a BEA. And the standard right now is that they're testing for PFAS every time they do this, right? Because the goal is that you, as a new owner coming into a building, you want to find every contaminant that's there because you don't want to be blamed for it in the future. So we are going to see more and more of these small sites popping up, which is what occurred in Elk Rapids. Fortunately, Elk Rapids has a municipal water supply, and the groundwater goes away from the city or the village and not towards the lake and not towards the village. So those two factors right there. We did put out a press release just to make the public aware, but there was no threat to drinking water in that area.
Any other questions?
I don't have a question really, more of a comment. Dan and I have spent a lot of time together in the past month or so because I sit on the Sanitary Board of Appeals, and it seems like we're together at least once a week lately.
That's about right.
Yeah, and I would just point out that Dan does a great job in representing the health department. He's very professional. He appears very thorough. He's a good listener, and I appreciate your professional demeanor when you're part of something that can be fairly contentious at times there, Dan. So thank you.
Thank you, Scott.
Thank you. Any other comments? Regional Planning Director reported on Shire activities for equitable access to care and the assessments that are ongoing. Was there any questions regarding regional planning? If you're ever interested in participating in a community assessment or have a group that would be interested in participating, Jane would be more than interested in speaking with you.
Well, there's a session this afternoon.
Yeah.
Starting at 2:00, and I signed up. It
Good.
depends on,
Mhm.
I'll log in when I'm home, but looked like it was worth doing.
I did want to remind everyone that I did send you an email with all of the sessions available in different areas, and we would love your participation, and even just for you to hear the constituents, relaying their needs is really interesting. If anybody had trouble getting the link to work, I know Rachel from Otsego had trouble. We got her a new link, and I think she's registered and is participating too. But if anybody had trouble, I can get you a new link. So just let me know.
And then medical director, just the communicable disease report. Are there any questions? Did see there was a tuberculosis. Want to comment on that?
Yeah, actually, and that was a case of atypical a non-tuberculous mycobacterium. But I would mention, because I think by the time it actually counted as October, but it takes a while to diagnose tuberculosis. We do have a case of active TB, pulmonary tuberculosis in Emmett County. We don't get a whole lot of TB, but we seem to get one about every other year. Used to be a little even less common than that, but it can take a lot of resources because we don't have endemic TB in this country for the most part. We don't have people spreading it, and that's because of a lot of control efforts. So when we do have a case of tuberculosis, it's imperative we have a nurse that works closely with the treating physician to to help manage that case, to help support the patient, to make sure that they get the medications they need and the evaluations they need, and are able to isolate so that they're not spreading tuberculosis, because we don't want to have endemic tuberculosis in our communities. So that's actually where a lot of the communicable disease rules came from. And when you look at the county's responsibilities to pay for the control of communicable diseases, a lot of them relate back to that, because that was a much more common issue back in the day, but still an ongoing problem because our world has just shrunk. So that's going on. We have a couple nurses who work closely with that patient to help assure that they're able to continue to take their medications in a timely way to treat them. And it's not an issue of welfare, to remind everyone. It's an issue of communicable disease control. If needed, we pay for the medications and things like that, because it's the county's interest that that person no longer be transmitting tuberculosis in the environment. So it takes a lot of time, because unfortunately it's a tough disease to treat. It takes 6 months at least of treatment, sometimes longer. So it's an ongoing process that we follow along until they're completely done with the treatment.
You can correct me if I'm wrong, but this is one of those things that if there are expenses associated with an outbreak or with a single case that aren't covered, the county individually covers those. So that cost is a county cost.
That is correct. And again, it doesn't happen too often. And usually your counties get a bill for medications for different things. It's usually not a whole lot, but tuberculosis can get to be expensive because of the overwhelming time. But the way the public health code and the state law is written, it's the county of residence that is responsible. They're payers of last resort. You obviously bill insurance or any other assistance. If the person is able to pay, then they pay. But if they cannot pay, then the county is responsible for the treatment of those communicable diseases.
So it's important that we identify and isolate. Definitely an outbreak of multiple individuals would be very costly to individual counties, potentially. I did have a request that I incorporate a bathroom break, so I think I'm going to do that at this point, just prior to. So,
Somebody else is thinking along my lines.
that clock is wrong. We will come back at 12:15. There's sandwiches. I'm hungry. Is there a second?
I'll second that.
It's been moved in second. Is there any discussion? I'm sorry, I should probably do this as one motion and include the employee expenses of 26,156. I'm sorry, 156.14. Is that acceptable?
Fine for me.
Yes. Thank you. Is there any comments, questions, concerns? Hearing none, roll call, please.
McKinnon,
Yes.
Coon,
Yes.
Valerito,
Yes.
Howard,
Yes.
Ruben,
Yes.
Markey,
Yes,
Roloff,
Yes.
Hankins.
Yes.
motion carries. Any other personnel and finance updates that we need to address? I don't recall any. We've already addressed the county. Program and Evaluation Committee, update on the bylaw and board rules that were discussed and upcoming dates that you have planned. Who's the chair? Chair?
Yeah, so we met last
Thursday.
yeah. And we got a bunch of bylaws from different health departments and got some operating procedures for different board of commissioners, and And we're looking through them. I think our next meeting we set for the 17th, correct?
That's what I remember.
January
Yep.
17th.
January.
Yep. January 17th, yeah, not December. So we want to go through them and have something to turn back. We don't just want to take our first go around and then have to rehash it out here. So we want to have something decent to return to the full board. So I think that's where we're.
My understanding is that the parliamentarian didn't join you for your first meeting. Do you plan on having her for subsequent meetings?
I plan on asking her when we get somewhere just to get some more input. Yeah.
Anybody have any questions, concerns? I think my only comment is that we make sure that when we do review those, that emergency situations occur and we have to put something that allows for decisions to be made one way or another that vary from our bylaws. So if the the building burns that you're supposed to have your meeting in, you can't have a meeting there. If that says it's the only place you can have a meeting, what do you do? So just kind of those things that we've experienced in the past couple years really come into play, and I'd appreciate that consideration.
The language should be in the event it's appropriate or necessary to suspend the bylaws, requires such and such vote to do so. So I think some of the examples that you got may have addressed it that way, but Robert's rules talks about suspending the bylaws. That was one thing that Julie and I, once the issue came up, were texting back and forth about. So her term is suspend, but once you get Julie to look over your draft, I'm sure that there'll be proposed changes.
I know we talked about at our board was that the chair in coordination with the administrator could make some calls on different things. So there was not only just to the chair, it might be chair and vice chair had to agree on changes or suspensions of certain laws, those kind of things. And that was in relation to COVID, especially. We had a lot of grants coming our way, and we usually met to approve grants, but the turnaround time was so fast and needed for like personal protection equipment that we authorized our chair and the administrator to move forward on grants related to that and bring them to us as a update rather than an approval if necessary, which is contrary to our overall policy. All right. Next item on our agenda is for closed session pursuant to MCL 15-268, Section H. Closed session, permissible purposes, states a public body may meet in a closed session to consider material exempt from discussion or disclosure by state or federal statute. Material subject to attorney-client privilege is exempt according to Section 13(1)G of the Michigan Freedom of Information Act, MCL 15.2431G. Because FOIA deals with public records, only written legal opinions may be discussed in closed session. That is what we are going to be doing. I need a motion to go into closed session pursuant to MCL 15.268H to discuss an attorney-client privilege written legal opinion letter received from Lisa Peacock's attorney dated November 26, 2021, with the following in attendance: all Board of Health members, Lisa Vogler, our general counsel, Jennifer Kenny, our administrative assistant to take the minutes, and Terry Tallis, our CFO.
So move.
And I'm sorry, and Jim Young was going to join us as counsel on the phone.
So move.
Is there a second?
A second.
It's been moved and seconded. Is there any other individuals that need to attend?
I have a question about Ms. Tallis. What would be the purpose in her attending?
I can answer that. Ms. Tallis is the designated representative for MMRMA in this matter. MMRMA requires that someone be designated at the organization.
Okay, thank you.
Yep.
Any other questions or discussion? Hearing none, roll call, please.
Valerino,
Yes.
Powers,
Yes.
Ruby,
Yes.
Harvey,
Yes.
Rolla,
Yes.
Hankins,
Yes.
We'll reconnect with her later.
Yes.
Coons.
Yes.
Motion carries. We'll give the, check a minute to shut down cameras, microphones, etc. We'll go into closed session only. Our next meeting place and time, we typically don't have a meeting in January. It's because of the appointment process with the Board of Commissioners, typically on years that they have new terms. This is not a new term year, however, it has been practiced in the past not to have January meetings. So the proposed next meeting date is going to be February. Somebody have a calendar? First Tuesday of February.
To the first.
February 1st. Antrim County has indicated that we can continue to meet here if that is the preference. Right now, the conference room at Charlevoix is starting to empty out of supplies and being turned back into a conference room. That may be a possibility. I'd like to leave it the ability to move the meeting if we need to out of Charlevoix, if we plan it for there, only because we don't know what's going to happen until we know. Any thoughts?
Well, one of the problems that we have in Emmett County is finding two people to serve on this board. And Matt and I are the only two left who are willing and available to do this. And Matt, of course, is a teacher. So, and I know Jairus has expressed a desire to have it later in the day as well. I realize that's probably an issue for staff, but if you did it at 4 o'clock or 4:30, and I realize that affects a lot of people. In our case, we're going to have a real challenge finding two people on to do this job.
We have at least 3 board members that work during the day on our Board of Commissioners, so would be good for Emmett County to move it to 4:30.
I mean, I can
So-
go through all of the list and it's just us, we're it.
So my proposal is the next meeting be February 1st at 4:30 at the Charlevoix Health Department Conference Room, with the caveat that we could change if circumstances dictated the place or time if needed. By call of the chair, is that acceptable on that?
Madam Chair, our existing bylaws state the place of the meetings will be at the offices of the Health Department or at such other locations as shall be specified by resolution of the board. So we would have to have a resolution to vary from that.
And that's what I'm asking, if that's,
The place you said was the Charlevoix County.
no, the Charlevoix County Health Department.
So the health department.
It's the health department offices in Charlevoix County.
So if it were at the health department, it says business hour, office hours or something like that. right?
Correct. It
I
says
just put it.
regular operative hours.
Is 4:30 still part of the regular day?
Well, what it says is meetings shall be scheduled during the regular operative hours of the Northwest Michigan Community Health Agency or at other times with the approval of the majority of the membership of the board. So we just need to approve it as
Yeah.
a majority, and we can have it at
Is that okay with you, Scott, though? I mean, we're asking you guys.
I can probably make 4:30 work. I'm not saying that. I'm just saying,
Oh, yeah.
to your point,
Yeah.
let's Played by the rules we have until we change those rules.
I love it.
If we were to pass that, if we were to authorize that, would that be in violation of the?
No, we just need to have a resolution to do
Yeah,
so.
right.
Excellent. Well, then, I really, actually, I love
Okay.
doing this. And I move that we
Yes.
hold the February Board of Health meeting on Tuesday, February 2 at 4:30 PM at the Charlevoix County Office of the Health Department of Northwest Michigan. Does that work?
Tuesday, February 1.
Yeah, I'm sorry, February 1.
Yep.
Yeah, that's why I hate verbal motions. Yeah. thank you.
Point of order, what is the difference then between a resolution and a motion?
Don't know.
Well, okay, I resolve. I could just change it that way.
Well, yeah.
Yeah, I mean, that's fine. I mean,
Well, a resolve would be for long-term. We're looking to, and you can do a resolve for this. It'd be a resolution for the next meeting, and we'd have to make a resolution for every next meeting,
Could we,
which if we don't hold it at the Charlevoix Health Department, then I have to still entertain that motion of where we're going to hold it. So right now, we're in a position of, we believe the room's going to be available. The board is here and can make that determination to hold the next meeting at that room at 4:30 on February. It's still during operative hours, although we will go over. We can utilize Zoom at that particular facility so that we can still have our staff members come in by Zoom. And we can do some flex scheduling, so for hours for them, because employee hours are an issue when we talk about outside of regular hours. And so our department heads will make themselves available. We could probably move that right up to the beginning for reports to make sure that we get through those. The other issue is it's a drive for folks, and so it's a little bit later in the day. Some people prefer not to. If this board is okay with doing the 4:30, we'll do that, and we'll leave it to the bylaws to kind of define that a little bit better. Now, in the event, let's say, and I hear your motion, hang on a minute.
yeah, that's fine.
In the event that room becomes unavailable or some circumstances prevent us from meeting there,
We should have a backup included in the motion.
Yeah, okay, that's fine. I'll restate the motion then, yeah. The motion, if,
so
I
what's
guess we'll
the
call it,
backup?
we'll call it a motion, then I will move that the next regular meeting of the Board of Health will take place on Tuesday, February 1 at 4:30 PM at the Charlevoix office of the Health Department of Northwest Michigan, unless otherwise required by unforeseen circumstances at the direction of the board chair. Does that sound okay? I mean, I just blather here, so.
I would pick this building as the secondary spot. If that one doesn't work, then this one. And we don't have to
all right with
bother anybody.
Well, I think we can, the
We only
motion
have
would be,
this meeting room for 2 hours, I think, on that Tuesday because of the planning commission. Just to let you know, they start at 7, so we would
Oh.
have it for 2 hours, which is doable. It's doable, I tell you.
we can, but it would be if unforeseen circumstances require something different at the direction of the chair, and she will understand that it would come here or something like that. If does that sound safe?
The criteria is safety, video so that we can do a Zoom meeting because there's a preference for people to be able to see our meetings. And also the ability that we can hear each other and accommodate public if needed.
So I have the bylaws right here. I don't see anything about it has to be in Charlevoix.
Yeah.
Well, it does say the office of the health department. That's the only thing.
Yeah, right there. All right. All right.
I appreciate that Charlie's made a motion. I don't think we've had it seconded yet, but we've moved on to discussion portion. So,
I just want to make sure we had the motion the way we needed to.
okay, I got it. Again, going by our current bylaws, meetings of the Board of Health shall be held on a monthly basis and at other times as called by the chairman. I appreciate Karen's position that a lot of commissions may not have made their appointments to the health department in time for the first meeting. But I don't want to see citizens not have the opportunity to address this body, especially when our bylaws specify that they shall be held on a monthly basis. There's no exclusion here for a January meeting. So I would throw that out, that I think we might need to have the meeting toward the end of January, but shall is a pretty
Well, and
specific term.
if we presume that there's gonna be something going on with some legal person somewhere,
Correct.
because we expire at the end of this month, and so.
I'm gonna miss you, Charlie.
We'll get over it. Like in about 5 minutes. But in what you said was, I was just looking at some notes here. Well, that on the 17th at 4:30, you got that health officer evaluation. So there's already something going on that day.
Well, that's the bylaws meeting.
That's a committee meeting.
That committee.
Oh, is that what that is? Oh, I didn't.
Yeah.
Okay, I just wrote it down.
Bylaws.
So, I mean, if you're doing them on Tuesdays, you could do Tuesday, the 18th, as long as you did it at 4:30 again.
Or the 15th, where we're gonna do bills anyways.
15th of January would be a Saturday. So
It
That'll
falls
be the
on
fall
the
to the
16th.
next, yeah.
Oh.
No, we would do it the day before. It's on a Saturday, we would do it on the 14th.
are you talking January now?
Yes.
But-
because we're gonna meet anyways, half of us will be here already.
So what were you suggesting then?
We normally meet on the 15th of every month for the finance committee.
Okay.
Friday
So
on a
it
Saturday.
falls on a Saturday, so we'd meet the previous day.
So 4 members are already committed to the 15th, well, the 14th.
14th.
Friday.
And 4 of us are committed on the 17th.
Right.
I'm sorry.
And the other 4 of us are committed on the 17th.
Yeah, right.
Take your pick.
Yeah.
I'm gonna say that the finance meeting is going to be bills. It's gonna be shorter.
Real
just
short.
As long as members have the opportunity to review prior, it goes rather quickly.
Is that the 14th?
That's the 14th.
So if you did it at 4:30 on the 14th,
Make it.
I mean, I think it's great. I mean, we could solve a few problems here and be in compliance and have something available if all the attorneys are.
So we can do bill pay at 4. And then regular meeting at 4:30.
Well, let me suggest then that I had that motion for February. Why don't we second and vote on that one, get it out of the way, and then I'll make another motion for the 14th at 4:30 to be the same thing. Unless you want me to just write the whole, make one big.
So you want to preempt and just decide Tuesday, we're gonna meet there at 4:30 as well.
If that's,
And on January 14th, we're gonna meet at 4:30 for a regular meeting.
Or for budget.
you want me to just restate the motion since there was no second and get them both?
Yes.
All right, I'll move that the Board of Health hold its regular monthly meeting on January 14 at 4:30 PM at the Health Department office in Charlevoix, and its regular monthly meeting for February on Tuesday, February 1 at 4:30 PM at the Charlevoix office of the Health Department. Does that?
Or
Good. Done.
So they're both going to be at the
Health Department.
Unless,
Unless unforeseen circumstances require that a change be made, which will be the
Both of those
at
are
the
regular meeting.
direction of the board chair.
I gotta change both those days.
Dan, give me a call because I am confused.
Okay.
I'm sorry, who was the support?
Jared,
Jairus supported. Thank you, folks, for accommodating us.
and so that'll be just so everyone knows, that'll be a discussion at your bylaws moving forward, like the time and place and how that's dictated.
So we'll take care of that later as far as what we do the rest of 2022. Is that what
Yeah,
you're
this will at least cover January and February meetings.
recommending? Okay.
Any other discussion?
I'm gonna hopefully be able to change both of those dates. I have commitments at 5 o'clock, work commitments, but I will hopefully be able to reschedule those. Or
Basketball.
get out of them. Yeah.
Thank you. We are going to have that every one of us. That's what's always so risky about changing these things.
It's been first and second, January 14th at 4:30 PM, regular meeting, and February 1st at 4:30 PM, regular
February 2nd?
meeting.
February 2nd.
I'm sorry, February 2nd.
February 1st.
February 1st.
Yeah.
Oh, you're making me February 1st at 4:30, both at the Charlevoix Health Department Conference Room. Unless unforeseen circumstances present themselves that require a different place or time, and that will be made at the direction of the chair.
Right.
Last chance. Roll call.
Roloff,
Yes.
Hankins,
No.
McGinnis,
Yes.
Coontz,
Yes.
Valerito,
Yes.
Howard,
Yes.
Ruby,
Yes.
Barkey.
Yes. All right.
Stairs too.
Okay.
And then the change of meeting, we talked about regarding Emmett. VP Pro Tem currently, Shirley is our vice chair. We had Charlie nominated as well as Rob for vice chair. And we ended in a tie with no majority, which resulted in the pro tem for Shirley. Do either members wish to withdraw their nomination? Rob,
No.
Charlie,
No, I'm fine, thanks.
anybody wish to switch sides at this point and vote for, change their vote from prior?
Maybe I'm gonna withdraw mine and let somebody else have a chance for a while.
Fair enough.
I mean, I'm sure they would, and I have, I've done a little bit of everything, so, I mean, if you have to have me, you have to have me. But if somebody wants to be it.
What you're
All
saying
right.
is you want to withdraw being vice chair.
Pro tem.
Pro tem.
Yeah. Is that what I just was clear what you're withdrawing.
Okay, well,
You are pro tem in light of we can't make a decision. So I will call for all in favor of Rob Pellerito being chair. Please raise your hand.
Vice chair.
Vice chair.
Raise a hand.
Fine. You voted for Palorito?
well, yeah,
Okay. Just want to make sure.
I know.
So you're
Silly, right?
switching.
No, I'm not.
You're not switching.
No, I'm not switching. I'm not.
Oh, okay.
We'll do it again. I would do
All
it
right.
again.
You have to wait the crowd.
I still love
Those, so there's two nominations. There's Rob Pellerito and Charlie McInnes. Okay, you have to vote for one. All those that want Rob as vice chair, please raise your hand. I have 4. All those that vote for Charlie McInnes as vice chair, raise your hand. So again, we're in a lock vote, so that puts me back to Shirley. You're my pro tem.
You keep the
And
job.
Congratulations.
You're the winner.
You're the
Madam
winner.
Chair, I was going to suggest, although we've already had the vote, but I was going to suggest that in the event there are different members in January, maybe we should table that unfinished business until January.
At this point, Shirley, if you're willing to serve as pro tem until we get further down the road, the vote might change.
Well,
Yeah.
And Jan,
as
yeah.
long as
The
I
whole,
got you
the whole
here,
thing
I'm
might change.
okay.
The whole thing might change.
Yeah.
So right now,
Yeah.
we have somebody in place moving forward into the new year. That's my concern, and I believe everyone's concern is we have somebody. So Shirley, you've got the short straw again.
That's okay, I'm used to it.
The next thing on my list is my county, Antrim County has entered or preliminary entered into a settlement regarding opioid litigation. And I don't know which other counties may be involved in that same type of litigation, but there's multiple suits.
What litigation?
Opioid.
Oh, okay.
Yeah.
And so there's settlements from different suits coming forward, and some counties participated, some didn't, some were in all. It's a class action. And the resulting settlement requires any funds that are gained are used very specifically for the purpose of helping those, helping to, I don't know how I want to say it, services that help with reducing opioid use and dependency. Antrim County utilizes services in outside counties for a lot of those type of things. We don't have a treatment center located in Antrim County. We utilize services through the Department of Mental Health, and we utilize services through private third parties based on whatever we need. And so when we're looking at that, we have this discussion at my board regarding the medical marijuana grant that comes back from the medical marijuana cards. Each of you get monies back from the state, and you have to use it in a similar way where you have to use it for a very specified type of thing. And so it was brought up at that meeting, why couldn't the mental health utilize those funds and be able to? Simple reason is because we became aware of it. Antrim County couldn't utilize those funds because we didn't have a program in place. The health department has the SAFE program, so they were willing to, we acted as fiduciary so that those funds could be utilized for those purposes within our community. I have a feeling that that's going to be somewhat similar to what happens with some of these settlements, is that we're going to have to rely on outside entities to kind of look at what we can do to utilize. And so for the opioid, mental health obviously would have some type of program, I'm sure, that they could utilize, but I'm wondering if the health department, and we do coordinate with the mental health services quite a bit, what opportunities might look like for counties such as mine or Otsego that might want to leverage those with what programs are already in place or could be in place to better utilize services. So I'd like to ask our health officer just to give that some thought. I don't know how much funds or where the funds are going to be or what your county's individual decisions might be, but certainly there's a relationship with community mental health director and our health officer that you guys could speak about what potential there might be so that the counties all have that available to them when and if, I mean, there's timelines and it's litigation, so it takes forever for that to finally come down. But I think it would be a good idea just to kind of know what the requirements are, but what coordination could be provided for the different agencies that we all belong to.
I'll just mention that there was just recently, and we talked about it at the last meeting, and it might have been in Jane's report this time, I can't remember, but there was just a very well-attended, robust behavioral health summit that was held in Northern Michigan a couple weeks ago. I think it was November 4th. And Jane is really involved in that. Jane Sunmacher is really involved in that coordination. And it involved multiple community agencies from across Northern Michigan. It's not just the health department, it's all kinds of partners, and focused on improving access to mental health, all kinds of behavioral health services, including substance abuse treatment and prevention. And they've developed several different action teams that are composed of people from all of these agencies that attended, that have a timeline of and goals of work that they want to continue. So that would be an option. You could have Jane, I would highly suggest having Jane come and talk to your county about the work that they're doing through the Behavioral Health Initiative. Michigan State is helping to provide some of the staffing support for it. And it sounds like it's going to be a really robust effort and coordinated effort across the region.
Is Emmett involved in that? Do you guys know? Have you heard?
I don't recall hearing that. That doesn't mean that it isn't. I just have not heard about it.
All right, because I know Benzie is.
Okay.
I think Charlevoix is too, because we had Bernstein. Remember Bernstein from Detroit? I can't remember his first name, but he was years ago.
Relatives of Sam.
What's it?
Sam Bernstein. It is relatives of Sam.
Yes,
Yeah,
it's
I
his
know
son.
that.
It's
Yeah.
his son, and he was in our audience, and it's like, this has been years ago. And we said, okay, fine, we would then come back, but we are involved in it, so.
Well, I just think that if we should know what's available instead of trying to reinvent the wheel and spend monies in producing that wheel, that we got some resources that might be beneficial to all counties.
It's a lot of money's coming through.
They're right.
Yes, a lot of money.
Well, in Charlevoix County, you have, in Boyne City, you have a unique Nathan's House, which is a recovery.
The recovery. thing,
Yeah,
and-
recovery
Yeah,
house.
in Boyne Falls, there's one also.
Yeah,
So,
So, there's a lot of different avenues in which I understand that opioid money is being utilized in any given county that's participated. So it's good. It's a good thing.
And then my final on my list is, there was a public comment asking about masks and why we wear them at this meeting. I will defer to the health department has a requirement for indoor, for their employees, that masks are required as a function of the health department. This meeting is requesting that members also wear masks, but is not required of the health board members. So my choice is to wear it during this meeting because out of respect for the rules of the health department for their employees, but also they work with people all the time that are involved in the COVID activities, quite frankly. And so it's my hope is that they stay healthy to be able to continue to do service. So with that said, those were all my various matters and unfinished business. Any others from board members?
Move we adjourn.
Pardon?
I said, as fast as I could say it, move we adjourn.
Anything from staff? Various matters, unfinished business. Enjoy your holiday.
Yeah.
Stand adjourned.
Thank you, Karen.
Thank you.
You bet.